And so we can be mindful of time. We will have this post available later. I really want to get into this conversation today. We have our two experts on the call. But first, my name is Angela Golden. I am the Patient Education Program Manager for PHA, and I'm very, very excited to host this live in this conversation with Dr. William Auger, who spent 33 years as director of the UCSD CTEPH department. And we have Angela Michelle, who is a strong PH advocate and CTEPH patient with us today. As you may know, November is Pulmonary Hypertension or PH Awareness Month. And during this time, PHA offers an interactive calendar to help raise awareness on pulmonary hypertension. Each day of this calendar has an activity, a fact, or a resource that is available to educate on PH, pulmonary hypertension. We hope that you would take some time and visit the calendar. You can find that at phassociation.org/awareness month. With that being said, November 9th is actually CTEPH Awareness Day. And on this day, we hope to educate the PH community on the importance of understanding a CTEPH diagnosis, some signs and symptoms of CTEPH, and who may be at risk. But before we do get started, I would also like to say a special thank you to our sponsors, Janssen Pharmaceutical for its diamond sponsorship and United Therapeutics for its silver level sponsorship of the Connects Fund, which sponsors patient education programming like this. So now we're going to go ahead and get started and jump into our conversation. Again, we have Dr. Auger here and we have Angela Michelle here, who are committed to educating the PH community, specifically on CTEPH. And with that being said, I'd like to start the questioning right with Dr. Auger. Can you explain a little bit more about CTEPH? That was a big word. That was a big word for me to say. So can you share a little bit more to the PH community who may not be aware?
Well, you know, doctors always talk in abbreviations. You know, it's just so you like to shorten our sentences. But CTEPH stands for chronic thromboembolic pulmonary hypertension. So it's pulmonary hypertension due to old blood clots or organized blood clots. So the concept here is that patients who develop CTEPH have previously experienced the pulmonary embolism in the past. So a clot that traveled to the lungs from another spot in our body, from our veins, pulmonary embolism, and over a period of time, that fresh blood clot turns into scar-like tissue, either blocking or narrowing the pulmonary arteries, and eventually, if nothing is done or a treatment isn't tried for folks who develop those old blood clots, patients go on to develop pulmonary hypertension and or right heart dysfunction from these blockages within the pulmonary arteries. So that's the quickest way of explaining CTEPH.
And along with CTEPH, you mentioned pulmonary hypertension, but can there be some overlapping signs and symptoms where people may confuse, is this CTEPH or is this just PH complications? Can you explain a little bit more about the signs and symptoms of CTEPH?
Well, let's go one step before that, because I want folks to understand that this is a form of pulmonary hypertension, and it's important to recognize it because there's so many treatment options for patients who develop CTEPH. And as I said, it's due to chronic or old blood clots. So folks may be wondering, oh, gee whiz, you know, I had a pulmonary embolism years ago. Do I have CTEPH? Or so first of all, how often does that happen? So if you experience a pulmonary embolism and your doctor appropriately puts you on anticoagulants, what's the chance of me getting CTEPH? And we think there's about a 3% incident rate, meaning 3 out of 100 people who experience a pulmonary embolism might go on to develop chronic thromboembolic disease or CTEPH. Okay, so it's not very common. Okay, and so that's point number one. Point number two is that, folks say, well, gee whiz, I have pulmonary hypertension. Do I have is CTEPH the reason? And the reason why that's a really excellent question to ask is because the presenting symptoms are pretty nonspecific. The primary presenting symptom is shortness of breath with exertion. Doc, I used to be able to go for walks, or I used to go, hiking, or I used to go, on my boat. I had no problem with that last year, but now I'm getting more and more short of breath, and I just can't do as much as I used to. And a lot of people say, well, I'm picking up a lot of weight, or, I'm not as young as I used to be, so on and so forth. But that's the vagueness of the presentation is sometimes why it's often very difficult to make the diagnosis. Okay, so the presenting symptom in most people is a change in exercise capabilities or shortness of breath with exertion. Okay, and it's also important to understand that not everybody knows that they've had a pulmonary embolism in the past. About if you, again, took 100 patients with CTEPH and asked them that important question, anywhere from 10 to 30% of those folks would not recall that they've had a PE or a blood clot in the leg. And so it can be relatively hidden, the diagnosis, if you will. And that's why PHA and folks with pulmonary hypertension is very, very important to understand this message. Sometimes the first presentation of CTEPH is I have pulmonary hypertension. It's not that I had a blood clot and now I'm short of breath 2 or 3 years later. That's not, that happens in some people, but in the pulmonary hypertension community, often the first presentation of CTEPH is pulmonary hypertension. And so that's why it's critical when you're working with your pulmonary hypertension doctor, okay, and your cardiologist, your pulmonologist, your internist, if you do have pulmonary hypertension, it's really critically important that your doctor rule in or rule out CTEPH.
It sounds like because of the already complex nature of pH, this adds another level. I would like to kind of shift this to the patient perspective with Angela. We've had conversations before this call, obviously. Was your diagnosis, straightforward, or was it complex? How were you diagnosed with CTEPH? Can you share a little bit about your signs and symptoms and diagnosis?
Yes, thank you. Thank you for having both of us here. Raising awareness is so important. So I didn't have a simple road to diagnosis. I was struggling to breathe as far back as I can remember, about 2005. And for years, I was told it was asthma, it was allergies, or it was just my weight. At the time, I weighed about 150. At my heaviest, I've weighed 256. So over the course of having this disease, as it became harder and harder for me to work out, I started putting on more and more weight, and it just kind of went in circles. And so every doctor I saw was like, it's just your weight, just work out, try hard. And I would do it to the point of almost passing out, just thinking, I'm not trying hard enough. I wasn't diagnosed until 2018, and how I was diagnosed is actually really interesting because it wasn't my own medical professionals. In 2016, I had a stroke caused by antiphospholipid syndrome. I went into what is known as CAPS, that's catastrophic antiphospholipid syndrome. We know I had the stroke, I had blood clots throughout my body, including my lungs. And then it was the following year, I ended up in the hospital for a very minor surgery. And they realized they couldn't put me under anesthesia because my oxygen levels were not sufficient. But they didn't understand why. And there was a point where I was on oxygen 24/7, but no one could tell me why. And when I had my stroke in 2016, unfortunately, 2 hospitals missed it. And that misdiagnosis of a stroke made me very outspoken in sharing my medical journey. And so when I ended up on oxygen in 2017, I posted about it on social media. And it just so happened that an old high school friend found my post, and he's a heart surgeon. He was living out in LA at the time. He knew I'd had a stroke. He knew I had APS. Now I'm ending up on oxygen. And he just wrote me and he's like, have you ever heard of CTEPH? Have any of your doctors mentioned it? And I said, nope, no one's talked about it. What is this? He explained it. He explained that I needed treatment as soon as possible. He suggested that I go to UC San Diego because I already had a history of a stroke and I have complications. And so with his help, I was able to advocate for myself and insist that my local doctors do the proper testing to get the diagnosis of PH. So 6 months after my friend first told me he suspected I had CTEPH, I was formally diagnosed. But I will say that getting that diagnosis was difficult because a lot of the doctors I was seeing had either never heard of it or they thought it was very rare, which it is, but they didn't even want to think of it because they're like, it's really rare. And I'm like, okay, it's rare, but is it possible? And obviously it was, and it is. So luckily I did have my PTE surgery in UC San Diego in August 7th of 2018. I was number 3,916.
Wow. Thank you so much for sharing, this part of your journey with us, Angela. Going to Dr. J, is this typical for when patients are visiting, whether it's an emergency room or, just, I hate to say like a normal healthcare team, but if they're not with someone who specializes in PH, is it normal to kind of miss these symptoms in a patient where it could go undiagnosed?
Well, first of all, so what number were you?
3,916.
And I started at UCSD. They were at patient number 50. So.
Oh, wow.
Yeah. So it's been a very long journey for some of us, and I I would like to say that your story was atypical, but it's not. And you didn't have a history of pulmonary embolism, did you?
So in hindsight, they think I was having PEs as far back as 2013. I had a couple episodes of pleurisy and they just didn't catch it.
Again, that's very common. We've all had episodes of little tweaky chest pains in our chest that are typically musculoskeletal. We've had pleurisy due to viruses. And so this is the reason why some of these symptoms are really quite subtle, and we don't automatically, we're all human. We don't automatically go to the, oh my God, I'm having a pulmonary embolism or I'm having a, heart attack kind of thing. Often we explain things away. So, which is not, it's just human nature. Right. But again, I wish I could sit here and say, oh, that's a story that we rarely hear, but it isn't. And that's because the symptoms are actually quite subtle, as I said before. Just, I'm just not, able to do as much as I used to. And, doctors typically say, well, gee whiz, you're a little overweight, or maybe you got asthma. I can't tell you how often I've heard your story. It's and hence the reason why we do things like we're doing today, CTEPH Awareness Day. There are physicians all over the country now. The expanse of CTEPH programs within the United States have grown exponentially over the past 10 years. There was a period of time when I first started at UCSD, there were basically only 3 centers in the world. And so it's really expanded considerably because people, doctors, care providers around the country, around the world are acknowledge that this, both pulmonary hypertension, pulmonary vascular disease are becoming increasingly recognized as part of the presentation of shortness of breath for no clear reason, okay? And if you're thinking about pulmonary vascular disease and pulmonary hypertension, then you also therefore needs to think about CTEPH, or chronic thromboembolic disease. So the presentation, you know, and I'm sorry it took so long, but your story is not unusual. And I salute you so much for sticking with it and advocating for yourselves. And this is the part of why I'm so enthusiastic about doing these kinds of events, you know, to talk to patients, to talk to folks out there who also, you know, sometimes need to advocate for themselves and recognize and become educated about pulmonary hypertension, pulmonary vascular disease, and CTEPH. So it's very important. People often ask, well, what are the risk factors? You know, antiphospholipid antibodies. Yes, absolutely. Meaning some folks have this tendency to form clots, antiphospholipid, anticardiolipin, and lupus anticoagulants. Those are some pro-clotting, mechanisms within our body, okay, that put us at risk of developing CTEPH. And again, when I say at risk, I'm not saying, oh, if I got this, I'm going to get CTEPH. Not all people with these, pro-clotting tendencies develop CTEPH, but it increases your risk of developing a CTEPH. A prior history of a cancer diagnosis, a prior history of let's say, having long-term catheter placement for that haven't been removed, having had your spleen removed. There are, a family history of blood clotting. So these are some risk factors, meaning I'm at greater risk for going on to develop chronic blood clots. Okay. And so, yes, there are risk factors that one should be aware of. Okay. And so, that's part of the issue of, gee whiz, if I have some of these things and I'm just, I'm short of breath, I'm really not able to do, as much as I used to. And it's in all age groups. People would say, well, I'm only 26. I can't possibly get CTEPH. Well, that's not true. There are folks, at UCSD, we operated on folks as young as 8 and as old as 88. And so the median age is in the 50s, but again, all age groups we have seen. And it's particularly noticeable, and the diagnosis of asthma typically occurs when, we have, a very young person who comes in and well, gee whiz, they were playing football, 2 years ago, and now they can hardly walk up the stairs. And so, oh, you have asthma and blah, 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 because gee whiz, nobody thinks of pulmonary vascular disease or CTEPH. And so awareness is critically important that this is a potential diagnosis. And I keep on going back to it's pulmonary vascular disease. You think of that first. You rule in or out pulmonary hypertension, and then you move to the possibility of CTEPH or chronic thromboembolic disease. That's a very important point.
So I'll jump in real quickly. Sorry, I had some technical difficulties and I was off the live for a minute, but I am back. And thank you so much, Dr. Auger, for sharing more about who is at risk and those signs and symptoms. Angela, following up to your journey, what was the process for you from realizing, you were diagnosed with CTEPH to actually having surgery? And then afterwards, I'd like to discuss the process with you, Dr. Auger, of surgery and moving forward. So, sure. Angela, from diagnosis to surgery, what was that process for you?
Sure. So I was actually formally diagnosed in January of 2018 through a right heart cath. And that was the official diagnosis. From that point, I was told by my lung specialist, my pulmonologist, that they would not be treating me further, that I was being referred out to a PH specialist here locally in San Antonio. So I was sent to them in early February of 2018. I met with him once. He asked me if I understood what I had. By that point, I had done a lot of research. I said I did. I said I understood that surgery was probably my best option, but that there was other possible treatments, including, medications they could do. And so I was put on a Dempus initially while I waited to see if I was a candidate for surgery. My doctor did decide to send me to UC San Diego. At the time, I'm in Texas, and Texas was just starting their PTE program. So I would have been like one of the first few patients. And my team felt like, considering my history of a stroke, they just felt like UC San Diego had more experience. So I had my records sent out there in middle February, and it took about 6 weeks to hear back. I was invited out for evaluation. My evaluation was scheduled for the end of July. So I had to wait from March to July, not knowing if I would actually have the surgery, because the way it was set up is you go out there, you're tested, and then they either say yes or no. And if it's a yes, the surgery happens like a few days later. So for me, that was the hardest part, is this waiting in limbo and not knowing what the future would be like. Luckily, I did make it out there, and after all the testing, they determined I was a candidate, so they went through with the surgery.
And Dr. Auger, is that typical of diagnosis through surgery, that there is this sort of wait period to make sure that, one, you are a viable candidate for this surgery? Is surgery always the answer for a CTEPH patient?
Again, Angela, your story is very typical, but it's changing as far as our ability to extend care to as many patients with CTEPH as possible, which is why we're also running into other problems with, expertise and capabilities. I can tell you that, yes, San Diego is the biggest, literally the largest CTEPH or endarterectomy program in the world. There's no question. Okay. And with that comes a tremendous amount of expertise. We've been doing it a very long time. And we have, folks that are extremely capable and extremely experienced. We'll do the toughest of the toughest cases because of that level of experience. But that doesn't mean that we're the only place at UCSD. And I tell you, UCSD for decades has been involved with teaching folks, surgeons, and care providers from around the world how to do the, properly do diagnostics, properly do, provide, perform the surgery, as well as now providing other management interventions, if you will, to help treat patients without operable disease. And I am so happy that there are a number of people that have joined us today who have had surgery elsewhere, because there are other excellent centers in the country that are growing, that are developing that level of expertise, because you shared a story. You did your research, you talked to folks in Texas, and we're a very small community, the CTEPH community, particularly with surgery. We all know each other. We've a lot of the folks that you've talked to and other people have talked to have trained at UCSD. They know what to do. We constantly discuss cases that are tough. Where would be the best place for that particular individual to have their operation, so on and so forth, because there are levels of capabilities that you could imagine. If your surgeon has performed 2,000 of these versus a surgeon that has performed a dozen of these, we only want what's best for you. But we also know that even the surgeon that's performed a dozen, these are not bad surgeons, and there are operations. There was a time when the surgeons at UCSD had only done a dozen. So, everybody is gaining expertise, and it's a difficult choice. But I want folks to understand that the physicians, what we are trying to determine is not only do you have CTEPH? Okay, because there is a differential. Okay, when you look at the studies, CTEPH is not the only reason why people develop that shortness of breath or develop skin abnormalities. So first, do you have CTEPH? Second, is it operable? Okay, that's the most important. If it's operable, then you should have surgery. If it's inoperable, okay, then there are other options, medications, and now balloon pulmonary angioplasty that's been developed, and expertise in the U.S. is growing over the past 5 to 6 years. Okay, so that's an important point. And so the determination is: one, do you have CTEPH? Two, is it operable? And if it isn't operable, what can be done to help folks if they can't have an operation, or if the risk of the operation is too high? That's the reason why, if you do have CTEPH, with your cardiologist, your pulmonologist, your internist, it's determined you have CTEPH, go to a CTEPH center that has expertise in CTEPH to help with that management plan that's best for you. And so that's something that everybody on the call today should really understand, because that's what we're here for. But get the level of expertise that you need to make the right care plan for you.
And I would be remiss if I didn't mention that PHA also offers, we have PH Care Centers, and you can link to that on our website, Pulmonary Hypertension Care Centers, which is available to find a PH specialist in your area and then hopefully connect to a CTEPH specialist as well. So there are opportunities to go right to phassociation.org and get information to help find you a specialist. And I know we're coming up on 30 minutes. One lingering question for Angela: after your surgery, what was it like, recovery time, or just dealing and navigating in the space after surgery? If you could quickly share a little bit about that for our viewers.
Sure. So Dr. Auger, you brought up BPA, and I just would like to say that the surgery is amazing, and it got me off oxygen 24/7, and it definitely saved my life, but it did not cure me. And I think that there is this misconception in our community that a surgery is always, it's always the answer. And if it's performed, that it is the end all be all. And it was not for me. So after surgery, the recovery was about 2 months of, trying, like, not lifting heavy things and sleeping uncomfortably and all that kind of stuff. But that's all stuff you can get through. I did have a slight complication a month after of a pericardial effusion. So I had to address that locally at my hospital. And then I was kept a close eye on. I ended up going for a year evaluation after the surgery because I was still struggling to breathe. Things were still physically hard for me. I was still short of breath on exertion. So this time they did another right heart cath, this time with exercise. It was determined I still do have PH. And talking to the team in San Diego, it was recommended that I have a balloon angioplasty. So even though I had the surgery, I had to go on to have BPAs. I was originally supposed to have my BPAs in May of 2020, but COVID hit and delayed all of us in all different ways. But luckily, I did make it out there this year. So I've had now 3 BPA sessions, and I can honestly say that those BPAs made a huge difference in my ability to breathe and to exercise. And I'm thankful for the surgery, but I'm even more grateful that I could go on and have BPAs in addition to it as well.
Absolutely. And thank you again for sharing that. And I think it's really, really important to share with those watching this that sometimes there are other options that may work best. One, your body and how you're feeling. So if that surgery doesn't feel the best for you, if there or maybe the treatment isn't the best and surgery is the option, to to weigh through your options of what works for you with CTEPH, with pulmonary hypertension in general. Coming back to you, Dr. Auger, as we kind of wrap up this very brief live, which we hope to have more engaging content on CTEPH specifically throughout 2023. So stay tuned for that. Any words of advice or wisdom or guidance that you can give patients watching this live? What you hope that they would take away from the information that was shared briefly today?
Yeah, I want to go back to the which is really, really important. You know, Angela made some wonderful observations about surgery and some people, it's not a cure. I do want to emphasize to this group that it is clear after multiple decades of research and data, okay, what's so important about CTEPH in making the diagnosis. So let's say you're seeing a pulmonary hypertension doc and they have yet to rule out CTEPH. That's the first discussion you got to have. The reason why the identification of CTEPH is so important is because it's potentially curable. Okay? It is potentially curable. And surgery, after decades of work in this field, surgery is your best chance of getting to a cure. Okay? Period. All right. So if you are a surgical candidate, okay, there is an option for a cure. Does that mean we cure everybody with surgery? As Angela has properly pointed out, the answer is no. Sometimes the clots are too far to remove, too far out in the pulmonary arteries to carefully remove. Okay. We can make some people, because it's not all people are, some folks have clots that are proximal, some are distal. Okay, we get out the proximal ones, but the ones way out in the pulmonary circulation, you just can't get them out surgically. Okay, so those folks don't have a cure. This is the reason why you need to work with a CTEPH expert center. Okay, because yes, better, not a cure. What's so exciting in the CTEPH community right now is that we now have other options to help folks further. Yes, I had a surgery, but you know, I'm not a cure. Okay, what else can I do? There are medications that are now FDA approved. Okay, there's now this balloon angioplasty, which we really haven't described to our audience today, Angela, but it's a new technique that we can actually go into the pulmonary arteries and with a balloon catheter kind of push the clots aside and either and decrease the narrowing that occurs as a result of those chronic blood clots and increase flow to those regions of the lung, decrease the pressures even further. And that's what's really, really very exciting in the field right now, is that we have more options than we used to, even just 10 years ago. And so, yes, some people cure with surgery, and that's your best approach because then you don't have to do anything else. You're off oxygen, you're not on medicine, so on and so forth. But that's not everybody. And some people need more, which is great that we can now get people like Angela better, even if they've had the surgery. And I could see by some of the messages on you know that I'm being displayed here that some people have gone through a course very similar to yours, Angela. And truth be told, based on our growing experience with BPA in the United States, up to 30% of patients who undergo BPA had surgery previously. And so that's not bad news. That's not the surgery didn't work. It's just that there are some clots we just cannot remove surgically. Good news is now we got something else to really help people even further, extend their lives, make their lives better, getting them back to work, getting them, you know, playing with their grandchildren and doing the things that they would like that they just weren't able to do previously. So this is a very exciting time in the CTEPH world right now. And I hope this session has been helpful to folks that have joined us today.
Absolutely. I think it has. I think, you know, just even validation from the conversation that's happening and the conversation that's happening in the chat, a lot of people have had that similar or shared experience. Angela, any other takeaways or lasting words you would like to also share with our audience today?
Just to have hope. Like Dr. Auger said, there's a lot of different options now. We're in a very exciting time. Attending the PHA conference this year was very enlightening to hear all the speakers and learn about all the new, medications and procedures and diagnostics that are being done to help us. And so, we have to be our own advocate. I think I'm very passionate about that. So, research as much as you can, look for the experts. PHA is a great resource for that. And, just stay strong because you can get through this. We all can.
And I do need to remind the audience that, Angela, your statement is exceedingly important. The accredited PH centers, in order to become accredited, they need to have a solid link, either their either they're CTEPH experts themselves, or they have to have a solid link with a CTEPH center in order to become accredited. So reaching out to accredited, centers is a good way of getting to a CTEPH expert center.
Absolutely. And I know we dropped in the chat the way to link to find our accredited centers. I would like to share that information with you again. It's phassociation.org. You could travel to our website, type in care centers, and you'll have access to that information. And I also would like to share, yes, this live will be posted after we conclude for the day, but you can also get additional information on CTEPH from our awareness calendar, as well as traveling to phassociation.org/CTEPH day. With that being said, thank you so much to Dr. William Auger and Angela Michelle. It has been so enlightening to have you here. I can already tell the impact just from the chat that this was a much needed conversation on CTEPH, and hopefully we did raise some awareness on next steps if you have a suspicion or you feel like there's an additional diagnosis. Hopefully everyone that is watching is informed and educated. And don't forget to please visit our Awareness Month calendar to get more information on CTEPH. Thank you again. And thanks again to our sponsors, Janssen and United Therapeutics, which supports patient education like this one. We appreciate you. Thanks for joining us today. I hope y'all have a great rest of your day.
Thank you.
Bye.
Thanks. Bye.